How many of you have gone under anesthesia for a surgery? All right, so how would you feel if you found out that medical students were lined up and giving you a pelvic exam while you were unconscious? Take a look at this. Women across the country are accusing certain university hospitals of allowing medical students to perform pelvic exams without their consent while they're under anesthesia for gynecological procedures. Some patients claim examinations occurred during completely unrelated procedures, and some say they've even woken up during the exams and felt violated. The hospitals claim that the patients signed consent forms, but patients argue the forms are too confusing. If you knew a pelvic exam was going to be performed on you by a group of students, would you sign off on it? First things first, Dr. Anita, can you walk us through what a pelvic exam is?
Well, during a pelvic exam, the provider will put 1 to 2 gloved fingers of one of the hands into a patient's vagina, and then with the other hand, they'll press on the abdomen. Basically, they're trying to make sure that the uterus and the ovaries, as well as any other pelvic structures, feel normal. And learning to do that pelvic exam is a typical part of medical school training.
So-called bimanual exam.
Yes, bimanual exam.
But have you all ever heard of this happening, where someone is unconscious and unaware and under anesthesia, and an exam is performed by someone who's not a part of the true medical team? Have you ever heard of this?
I have heard of it, actually. So my husband went to Columbia, and this is actually one of the schools that has been studied for this, that when the patients are under anesthesia, assuming it's appropriate that you're on that rotation, and there's, especially if there's something specific about the pathology, where you're not going to learn it any other way other than actually having that feel for it and that experience, that they will bring in the student and say, here, feel for this. This is what a mass feels like. This is what a large cyst feels like. This is how you differentiate the two. But the aspect of you being put to sleep and not aware of it, and nobody's explicitly told you that's what's going to happen, I think that's just so disturbing and so distressing.
So let's dig deeper into the ethics of this and then get into informed consent. And joining us now via Skype to weigh in is bioethicist Phoebe Friesen. Phoebe, when did you discover this was happening? What led you to do some research on this topic?
So I first heard of this practice. I was teaching medical ethics to students in New York. And the way that it was set up is medical students would come to a session I was running with ethical dilemmas they'd encountered in their training. And so the first time I heard of it, a student came in and said, yeah, I feel really uncomfortable. I've been asked to perform pelvic exams on women who are under anesthetic and have no idea. And sometimes other students will do an exam as well. So that's how I heard of it.
Dr. Friesen, I know you've done research on how prevalent this truly is, where the invasive exams are occurring when people haven't explicitly consented to that aspect by medical students. Can you comment on that?
A lot of medical students talk about this on forums online. Elle magazine recently did a survey of students in the States, and 61% said they'd given exams like this without consent.